Hi, my name is Joe DeVore. I'm the Senior Vice President here at Plymouth Harbor, and I'm here today to talk to you about something that's near and dear to all of us, reducing the risk, if not preventing, falling. We have a great relationship with our therapy company called Select Rehab, and recently they've partnered with VirtuSense, a company that has created an artificial intelligence machine that will analyze people's gait. And I'll let April Kennedy tell you a little bit more about that in a little bit. But I think this is probably, if not the most significant addition to our therapy department in the 9 years I've been here at Plymouth Harbor. It is certainly something that we hope will help all of you. And I hope you enjoy the demonstration.
Are you afraid of falling? I certainly am. And I've spent my professional life as an orthopedic surgeon putting together people's hips. It's a very bad problem for us older people. And I, for one, would not want to fall, and I would do anything I can to try and learn how to prevent that. Fortunately, now we have that opportunity here at Plymouth Harbor.
Okay, so this is the timed up and go test, also referred to as the tug. This is a walking test that's going to look at your stride length and your gait. So Dr. Groen, you marked yourself on the screen. That's the little green person on the left-hand side there. So when you're ready, you're going to hit the start button on the remote. You're going to get up, walk towards the screen, turn around, and come back and sit down. And you want to go as quickly and safely as possible. Okay, so we just did the timed up and go, and here are the results. So it's showing the step length, the stride length, and here you see we have all green, which shows that we have high mobility, indicating a low fall risk. And this is all the different measurements. It's showing step length, cadence, the swing, the stance. This is analyzing the whole gait pattern that the physical therapist would use for all their data. Okay, this is the functional reach test. This one can be done in standing or sitting, but we're going to do this one in standing. This is a balance test. So Dr. Groen, you're going to extend both your arms forward.
Like to do it when you're doing that?
No, go ahead. You can put your arms forward, and we're going to hit start, and you're going to reach as far forward as you can. And then come back. And bring your arms down. Okay, extend your left arm to the left, and then reach out to the left as far as you can. Good. Come back. And put your arm down. Okay, and then extend your right arm to the right and reach out to the right. Good. And come back. Okay, so now we're going to look at the results of the functional reach, which is now indicating low mobility. And I think that was pretty much because of the forward reach. Based on age, the system was saying that we should have been able to go about 10 inches, and you can see that was under where that should have been based on age, but the left and the right were very good. So that's why it came out as low mobility. So then we could go up here into recommended exercises, and it will show some recommended exercises that we could work on to improve different muscle groups that would help to extend that functional reach and balance. Hi, I'm April Kennedy, and I'm the rehab manager with Select Rehab. And as you just saw on the demonstration with Dr. Groen, the VirtuSense analyzes your gait, and it will also pick up on any balance deficits. So what the machine does is, after we perform these assessments using standardized testing with the artificial intelligence, it will spit out data based on your age on a national average, and it will tell us where your deficits are and what your mobility is. And based on that data, it will tell us if you have low mobility, medium mobility, and what your fall risk is. And after that data, it will also tell us what exercises would be most beneficial to you that we can incorporate into our therapy that will address these deficits to help prevent you from falling in the future. And that is really what this whole system is based on. It is about being proactive instead of reactive to address these deficits up front to prevent the fall from occurring.
Isn't that something? It just pinpointed what a problem that I know I have because they're very tight hamstrings and I can't reach forward. And so that affects my balance. So it does a marvelous job.
So you're probably wondering how you get set up with this machine. Well, we offer free screens with the machine, and we welcome everyone to get involved in that free screening process. And we would set that up with you. You would call us in the therapy department. We would get that free screening done. You would come and do the assessments, and then if we do identify that you are at a high risk for falling, or it doesn't even have to be a high risk, it can even be a medium risk or a low risk, but if we do see that there are deficits, the next step would be that we would contact your doctor to get an order for therapy services, and then we would initiate that process, which then would go through your insurance, which is usually your Medicare Part B benefit that the therapy gets billed to. And the other nice thing about this machine is we can also incorporate it into your therapy. It does have training. Again, if you've ever heard of the Nintendo Wii and that artificial simulation where you're kind of interactive with your therapy, there are the same kind of fun interactive games on it as well. So it's all about making therapy fun and interactive, and while you're getting better and doing what you can for your overall wellness and health while preventing that fall.
Well, I hope you enjoyed the demonstration. Thank you so much for Dr. Paul Groen for playing along. And if you'd like to get your session with the VirtuSense, give April a call, extension 166. Thanks and have a great day.